Well, penicillin allergies are the most common drug allergies in America, affecting roughly 1 out of every 10 Americans. Penicillin allergies are often discovered among children when they're being treated for common pediatric illnesses like ear infections, and typically that label will stick with them for a lifetime. If this has happened to you, though, there is a good chance that penicillin allergy label may no longer apply. For Oakland County mother of 3, Carrie Weingartz, penicillin has been off limits since the age of 4.
I broke out in a rash all over my body.
Carrie recalls her mother's description of the reaction.
She said it was kind of red and blotchy, and it was mostly on the trunk area.
Their family doctor at the time suggested she never take penicillin again. This is a familiar story to Dr. Ravi Kumar, a clinical assistant professor of allergy and immunology at Michigan Medicine and medical director of the beta-lactam service. Beta-lactams are a family of antibiotics, including penicillin derivatives and cephalosporins.
Oftentimes, both those antibiotics are commonly utilized to treat all sorts of infections, and oftentimes they're first-line treatment.
But not for those with allergies. That's where Dr. Ravi Kumar and his team come in. They reevaluate Michigan Medicine patients to see if those penicillin allergies are still valid. It requires a thorough patient history. Low-risk patients are given the medication orally and monitored closely with vital signs taken every 15 minutes.
When we've done this approach, over 99% of the people who have done this drug challenge have passed.
According to the CDC, less than 1% of the U.S. population is truly allergic to penicillin, and removing that label is vital to improving health outcomes. While there are other non-beta-lactam antibiotics, Dr. Ravi Kumar says often they don't work as well.
The risk of a surgical site infection goes up by 50% if something besides a beta-lactam is utilized at the time of surgery.
And he says the risk of contracting C. diff, a potentially deadly bacterial infection, increases by 30 to 40%. So who outgrows penicillin allergies? Dr. Ravi Kumar says just about everyone. If it's been more than 10 years since your last encounter with penicillin or another beta-lactam antibiotic, chances are pretty good you can tolerate them now. And that's good news for adults like Carrie.
I feel like it would just give me more options, because of the fact that people say different antibiotics are becoming more ineffective nowadays.
Now, using broad-spectrum antibiotics as an alternative to penicillin and related medicines is a factor in increasing antibiotic resistance. And because alternatives are less effective, they actually help drive up healthcare costs. So if it's been a while since you've been diagnosed with a penicillin allergy, it may be time to contact your doctor to see if that diagnosis is still accurate.
And this impacts a lot of people. I know as a child, I had an aspirin allergy. And so that might be worth revisiting as well, too, with my doctor.
Well, when you think about it, 99% of people who have this penicillin allergy challenge actually can tolerate it. So it affects a lot of people. 1 in 10 Americans say they're allergic, but the number is so much smaller.
Wow, great story. Thank you for that report.